Hi, I'm Bob Powell, editor of Finstream. I also write about retirement for several websites, including The Street. Recently, I wrote about a significant development that could impact the wallets of millions of Medicare beneficiaries. It's a projection that suggests a noticeable increase in your healthcare costs. Let's get straight to the numbers. Tucked away in the 2025 Medicare Trustees Report is a projection that the standard monthly Medicare Part B premium could rise to $206.50 in 2026. For context, that's an 11.6% jump from the $185 premium set for 2025. If this estimate holds true, it would mark the largest single-year increase we've seen since 2016, when premiums climbed a substantial 16.1%. It's crucial to remember that this is an estimate, not a final number. In fact, experts like Marcia Mantel, president of Mantel Retirement Consulting, warn that it certainly has a potential for the monthly premium to increase further before the final figures are published later this year, likely in the third or fourth quarter. So, what exactly is Medicare Part B? It's the segment of Original Medicare that provides coverage for outpatient and preventive care. This includes essential services such as doctor visits and lab tests, cancer screenings and flu shots, durable medical equipment like walkers and wheelchairs, some prescription drugs administered in outpatient settings, home health care and skilled nursing, mental health services and ambulance transportation. Currently, in 2025, the standard monthly premium is $185. Beneficiaries also face a $257 annual deductible, and once that's met, they typically pay a 20% coinsurance on covered services. It's worth noting that about 7 to 8% of the 68 million Medicare beneficiaries already pay higher premiums due to income-related monthly adjustment amounts. Now, this projected jump in 2026 might just be the beginning of a larger trend. Katie Vitava, founder of GoodCare.com, highlights that these aren't just isolated projections. They reflect a deeper, ongoing cost trend. She describes Medicare Part B as being in a hyperinflation mode for the foreseeable future. There are two primary long-term forces driving these increases. A shift of cost-intensive care from inpatient to outpatient settings. This means major surgeries or cancer treatments that once fell under Medicare Part A are now increasingly covered under Part B, pushing up those costs. The growing popularity and associated costs of Medicare Advantage plans. These plans now cover 54% of all Medicare beneficiaries, and remarkably, the Medicare Advantage program costs 20% more than Original Medicare. Given these shifts, Votava anticipates a plus or minus 10% increase in Medicare Part B premiums going forward. You might be wondering how Medicare Part B is funded. The 2025 Trustees Report reveals that the majority, about 72 to 75% of Part B funding, comes from general revenues from the U.S. Treasury. 25% is covered by premiums paid by beneficiaries, which totaled $139.8 billion in 2024. Additional revenue sources include interest on trust fund investments and brand name drug fees. A common question among retirees is about the hold harmless rule. This provision is designed to protect Social Security benefits from being reduced by Medicare premium hikes if the increase in the premium is larger than the Social Security cost of living adjustment, or COLA. However, for 2026, the projected Social Security COLA is 2.5%, which translates to an estimated $50 per month increase for someone receiving the average $2,000 Social Security benefit. Since the projected Part B premium increase is $21.50, most beneficiaries will not be protected by the hold harmless provision. The COLA is more than enough to absorb this projected increase. As Marcia Mantel explains, the COLA would have to come in below 1.06% for the hold harmless rule to apply broadly, which is highly unlikely. The only individuals who might be affected are Social Security recipients receiving less than about $800 per month. This could include dependent spouses with low-wage earning spouses, or individual workers who had many years outside the workforce with zero earnings in their benefit calculation. Nearly 4 million Social Security beneficiaries currently receive less than $800 per month. So, can you avoid this premium increase? According to Marcia Mantel, the answer is no. By law, each Medicare beneficiary pays 25% of the overall premium. This amount is typically deducted automatically from your Social Security payment. If you're not yet claiming Social Security, premiums are generally paid quarterly from your checking account or through online options with Medicare. While you can't avoid the premium increase, you're not powerless. Mantel offers 5 key planning steps you can take right now. Forecast your 2026 healthcare budget. Don't just consider Part B premiums. Think about all potential healthcare costs you might reasonably expect. Learn to use the Medicare Plan Finder tool. With some major insurance companies no longer paying brokers to sell their plans, you'll need to actively search for the lowest premium plans yourself during open enrollment, which runs from October 15th to December 7th. Call your members of Congress. Let them know you're concerned about these large projected increases and the burden they place on your budget, especially with other rising costs. Explore property tax relief locally. Check with your town clerk or other local officials for opportunities to save on property taxes. Some towns even offer programs where you can work a certain number of hours to reduce your property taxes. File your taxes using IRS Form 1040-SR. This form is generally similar to the regular 1040, but includes a higher standard deduction specifically for seniors. Beyond these practical steps, financial experts also advise you to stress test your investment portfolio. Senior research analyst Sudipto Banerjee suggests running your portfolio projections under your current spending assumptions, and then testing what happens if you increase your healthcare spending projections by a significant percentage. If the results aren't to your liking, it's a clear signal that you'll likely need to save more. The bottom line is clear. If the Medicare Trustees projections are accurate, as they have been in recent years, beneficiaries are looking at the largest premium hike in a decade next year. With healthcare costs consistently outpacing inflation, this puts significant pressure on retirement budgets. As Mantel warns, there is certainly a potential for the monthly premium to increase further, and each person's share could rise. It's crucial to be prepared.